Hello, 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 everyone. Thank you for joining for Ask Miss Jai Live this week. Today, we're going to be talking about gender affirming care, what it is included when we talk about gender affirming care or we think about gender affirming care, and how providers can be more inclusive and more affirming and provide gender affirming care and what that can look like in our healthcare and public health organizations and settings. So, stick around, learn a couple of things. And yeah, welcome to Ask Miss Jai Live. Hello, hello, hello. Thank you for joining for Ask Miss Jai Live this week. We will be talking about how gender affirming care looks, what gender affirming care is, what we think about when we think of gender affirming care, and how, as healthcare providers and public health organizations, we can be more affirming and provide gender affirming care. I'm coming to you live out of Denver, Colorado. So the background, everything is a little bit different, but I'm really excited to be here and to be sharing some of my thoughts on what this means and how we can be more affirming. So if you are catching this live, please put hashtag live in the comments. Let me know what your questions are, what your thoughts are as we're talking through this and what this looks like. If you're catching this on the replay, go ahead and put a hashtag replay. Let me know what you thought of today's conversation or what you think of gender affirming care and other points that you would like brought up or other perspectives you'd like us to think about when it comes to gender affirming care. So, first, what is gender affirming care? Often, when we think about gender affirming care from a healthcare perspective, we think about medical transition. And if you've caught some of my previous conversations this last couple of weeks, we've talked about three types of transition for trans and non binary people. So we have medical transition, which is hormone replacement therapies and gender affirming surgeries, or gender affirming procedures that shift the body in a more masculine or feminine way. And so we talked a little bit about that, and that's oftentimes what we think about in terms of gender affirming care is gender affirming hormone therapies or gender affirming surgeries. And so for a lot of healthcare providers may not understand that they can be gender affirming if they're working in an environment where they're not prescribing hormones or they're not performing surgery. And so we're going to talk a little bit about that today because we know that there are two other types of transition that we talk about within our community, and that's social transition and legal transition as well. So social transition being going by the pronoun that matches our gender identity or is closer matched to our gender identity, or going by a name that feels more affirming for us. And legal transition is when our name and our legal gender marker are shifted to be more in alignment with our gender identity. So when we think about gender affirming care and we connect it to just hormones and just surgery, then we miss out on the fact that lots of trans and non-binary people do not engage in hormones, do not take hormones, do not undergo gender affirming surgeries, either because of barriers to access those things. So financial barriers, having insurance that doesn't cover it, not being able to find providers who are affirming, or folks might not engage in surgical or hormonal transition or medical transition with surgeries or hormones because it's not part of their gender journey for themselves. There might be concerns around what it would mean to start taking hormones. There might be concerns around surgeries or how effective surgeries will be, etc. So a lot of this is individual, and we know that the majority of trans and non-binary people do not undergo medical transition. So we have to expand what we understand gender affirming care to mean, because we know that so many trans and non-binary people are not undergoing a medical transition but might still be engaging with our services. So when we think about gender affirming care, we have to think about how patients and clients are coming into contact with our services and I think about it from registration through referral. So from registration through referral, a person's self-determined gender identity is affirmed and cared for in the health setting. And that is what gender affirming care is. It's making sure that no matter what door someone enters into, it makes sure that no matter what step they're at in terms of getting their clinical care or their service provision completed, that they are being affirmed in their identity, their self-determined identity, and they're being respected and cared for. So how does that look, or how can that look? So when I talk about registration through referral, I think about some of the main points for myself when I've been a patient that I've been able to connect to clinical care. So I might call registration line in order to schedule an appointment. I may step into a check-in space and check in at a front desk. I may have to wait in a waiting area or a lobby. I may need to actually sit down with a clinician, or get my vitals taken. I may need to get referrals for other care, or referrals for specialty care. And then I generally have to do some sort of follow up, either a follow up in a few months, or I might be waiting for lab work, and then following up on that lab work. And so these are all contact points with our patients or with our patients or our clients. For the public health environments that I've worked in the past, we have similar points of contact. So folks may need to call to schedule an appointment with us. They may need to still check in at a front desk, or let someone know that they are there. They may still have to be in a waiting area or a lobby. They may still need to have an appointment with me, or sit down to discuss navigation of care or linkage to care. They may still need referrals for additional forms of care, and then likely there's some follow-up aspect. So these are all the points of contact where we see that trans and non-binary people may come into contact with our clinics. And so when I pose the question, is gender affirming care more than hormones and surgery? It's because when I've talked to clinicians and when I've talked to medical providers, oftentimes there's this perception that um, that gender affirming care, or learning about gender affirming care, learning about how to serve trans and non-binary people specifically, is not necessary unless the medical provider is prescribing hormones, or could, is engaged in some sort of surgical procedure with patients and clients, gender affirming surgical procedure. But because there are all these different points of contact where we want to make sure that patients and clients are that their self-determined gender identity is being affirmed and cared for, we know that gender affirming care is applicable to all folks who are in healthcare environments, who are working in healthcare environments, or public health settings. So, what can this look like? I'm going to give some examples of each of these, and how we can affirm folks. So, for registration, for example, if I'm calling and I'm scheduling an appointment, then folks may hear my voice and make assumptions of my gender identity based on my voice. Folks may make assumptions of my gender identity based on my legal name. Folks may make assumptions, all of these different kinds of assumptions. So when we are working with registration staff, when we were calling in to schedule an appointment, making sure that we are not using any sort of honorifics that assumes a identity. So making sure that we're not using honorifics like sir or ma'am or miss or mrs or mister, assuming a person's gender identity by the sound of their voice alone or by their name alone. We do know that most trans and non-binary people do not have all of their documentation in their current name or current legal gender marker. Only about 11% of folks have all of their documentation legally transitioned. And so because of that, we can't just go based off of someone's name or their legal gender marker. So if we coach up our registration staff to drop honorifics, that's a way that we can be more affirming of trans and non-binary people by not making those assumptions and unintentionally misgendering someone based on the sound of their voice. We may also ask when we're calling for registration, we may also ask if there's a name that the person would prefer to go by, or that the person goes by that's not their legal name, for our staff to call them while they're in the clinical setting. So that's two ways that we can be more affirming in registration. In check-in, so I think about when I'm checking in at a clinic, for example, I may need to sign in by my name or the time of my appointment. I may need to sign in with who I'm seeing. So if I'm seeing a physician or if I'm seeing a case manager. And so, and oftentimes that's on like a sticky note, or like a sticky piece of paper where that name is pulled off so that the person still has privacy and that you don't have a list of names listed for other folks to check in. And so if that is the process for you, then you may have someone put their name, but also the pronouns that they use, or someone put their legal name and the name that they'll go by in the clinic. So again, ways that we can avoid assumption and still be affirming in the identity of the people who are coming in to seek services with us. So we're not adding additional duties on top of the work that we're already doing. We're finding ways to fold it into our current work so that it is more affirming, because that's one of the big concerns that comes up. Oftentimes in healthcare and public health environments, we have a finite amount of time that we are trying to navigate and get patients or clients in and out of our services and get their health needs met. So if there's ways that we can fold it in, then we should. So with check-in, that might be a way. Similarly, if check-in is face-to-face and we're speaking to someone, then it might be, again, dropping honorifics. So maybe not referring to someone as Miss or Ma'am or Mr. or Sir. It could be asking for identification and current insurance card, but then asking what name the person goes by or what name they would like staff to call them while in services. So there are ways that we can move away from just referring to folks by their legal name. When I think about the next portion, which is the waiting area, so we've gone through registration, we've gone through check-in. When I think about the waiting area and how a waiting area can be more gender affirming, there's a couple of things that we can think about. So we might think about, is there already gendered material in our waiting rooms? So if we're working in a clinic that's serving folks who have uteruses and cervix, so if we're working in OBGYN offices, if we're working in offices that provide services like, well, women's checks, things like that, if the services are only geared towards women, cisgender women, then we might not be serving all of the clients or all of the patients who may be needing services. So we might have transmasculine folks or non-binary people who were assigned female at birth who also need services. So how can we create more inclusive marketing or a more inclusive waiting room in that environment? Similarly, do we have restrooms accessible? Are those restrooms single stall? If they are single stall, are they non-gendered or are all gender restrooms? Because if they're a single stall restroom, they don't need to be for a specific gender. If we do have multi-stall restrooms, do we have an all gender or gender neutral restroom that's nearby and within a reasonable distance? And is it ADA accessible? Because we also might be serving trans and non-binary people who require accommodation or are wheelchair bound or are needing a restroom that has a larger door or a larger environment or has handrails to support. So we have to think about the actual physical makeup of the space as well. And then the final thing I'll say about waiting rooms is that we might also need to look at what materials are out in terms of health services. So if we have, let's say we have brochures for folks talking about smoking cessation. If we know that trans and non-binary people also have disproportionate rates of tobacco usage, disproportionate rates of smoking, then we might want to include brochures that have trans and non-binary people's faces on them, or include some sort of coding for us to know that this is a service for trans and non-binary people as well, or having brochures or health information that is inclusive of how smoking rates might change when someone starts hormone therapy, or how how smoking while on specific forms of hormone replacement therapy can be incredibly dangerous. And so this is a way that we can start to integrate health information for trans and non-binary people into waiting room brochures and literature as well. And I see, hi Shakina, I'm so glad that you're here today. So I see that put a couple of comments. So providers can be overly focused on gender affirming care at the cost of not addressing other healthcare needs. Absolutely. And we're going to talk about that in just a moment, about what it means for us to really move into this like master status thinking, and what I mean by master status thinking is dissolving, or not dissolving is not the right word, but hyper focusing on one aspect of a person's identity, um, in a way that ignores other potential health needs. And so I see this happen in a couple of ways for trans and non-binary people. And we'll talk about master status thinking after I talk about a couple of additional pieces for gender affirming support. And I see you also put here using motivational interviewing to find out other healthcare concerns or issues ensures we are meeting all needs. Absolutely. Which takes me into the next piece, which is appointments. So, how can we be more affirming in our appointment settings? So, motivational interviewing, making sure that we are asking folks what their health goals are instead of assuming health goals. We don't want to assume just because a trans or non binary person is sitting in front of us or has told us that they are trans and non binary that their primary concern is just medical transition. For some folks, that might be their primary health concern and why they're seeking services. But for other folks, they might be seeking services for a variety of reasons. So, how can we be inquisitive and approach conversations with trying to assess and understand what the health concerns are for the individual and helping to address those concerns, prioritizing those concerns, so because the person is seeking services with us and to help build that rapport. So in the appointment, that's one of the ways that we can be more affirming. Other ways we can be more gender affirming is that we can listen to our trans and non-binary clients and patients when they're telling us what their health needs are. We might be more familiar as clinicians or as healthcare providers or public health providers with serving trans and non-binary people who are newer in medical transition, who are just starting hormone therapy, are just starting to seek surgical services, etc. And so if we start having patients or clients who have been on gender affirming hormones for long periods of time, let's say decades, or have had surgical procedures years ago, then we might need to let our patients or clients kind of take the lead a little bit more in terms of what they are needing around their gender affirming care or specific to medical transition, or just check in with folks like, have you had any troubles filling your medications lately? Are you having any challenges? Is anything new happening with your body? Have you been experiencing any sleep issues? But if you've been on these medications for a while, then likely we'll be able to inform you when we have had shifts in these things for ourselves. The other piece around being gender affirming in our appointments is also taking a trauma informed approach to the care that we're providing. And when I say trauma informed approach, I mean we need to acknowledge the role that trauma plays in being able to access services, but also in the ways that we relate and feel comfort in our bodies and relate and feel comfort in speaking and working with authority figures and physicians, clinicians, care providers, public case managers, all there's always going to be some amount of a power dynamic that exists because of the inherent nature of being an authority in the setting that the person has joined us in. And so, because of that, some of the ways that we can take a trauma informed approach is we can try and do as much as possible to put autonomy back into the hands of the patient or client who's sitting in front of us. So, that can look like making sure that we are asking folks if they are comfortable discussing sensitive topics before we discuss them. So before I launch into a sexual health assessment, saying part of today's assessment will include a sexual health assessment. Are you comfortable talking about that today? Would you also please know that if you want to stop the assessment at any time, that you can stop the assessment? So providing the patient or client with autonomy in that decision making. It may also include if we are, especially in a clinical setting, if we're doing any sort of physical assessment, whether that be checking a pulse or listening to lungs or listening to the heart with a stethoscope or doing any sort of physical examination, whether that be a PAP or a sexual health assessment, etc., that we are asking permission before we start, that we are explaining what the procedure is and why the procedure is taking place, and that we are letting the client know that they can stop the procedure at any time if it becomes uncomfortable or painful or they're experiencing discomfort or distress. So making sure that again we're putting autonomy in the person's hands is gender affirming care because we know that trans and non-binary people experience disproportionate rates of trauma and lifetime experiences of trauma. So we have to take a trauma informed approach when we are providing care, even primary care and some of what we might not have previously considered gender affirming care because it's not related to hormones or surgery specifically. I'm going to talk about two other pieces, which is referral and follow up. So, oftentimes, part of an appointment or the like wrap up components of an appointment are the referrals. So, where am I going next? Am I going to see another provider? Am I seeing a specialist? Am I getting lab work, etc.? Some of the ways that we can be gender affirming in referrals is we might vet the referrals before we send someone to the referral. So we might if we know that we're sending folks to a housing service frequently, or we're sending folks to get x-rays or diagnostics frequently, or we're sending folks to connect with dental care frequently, and that's not part of our purview or it's not part of our system, then we can call the regular referrals that we would send folks to and just ask them some basic questions around how they serve trans and non-binary people. So we might ask, do you have a non-discrimination policy that includes gender identity and gender expression? Do you have a policy on using pronouns and the current name of a patient or client when they seek services? Do you have services that are non-gendered, or do you provide services? Do you often serve trans and non-binary people? So these are some ways that we can vet the resource to see if it is if it is a safe place, or if it's going to be potentially a gender affirming environment to refer a patient or client. But we also have to recognize that some places are resource that we not all places have all of the resources or have gender affirming resources. And so we again don't want to take autonomy away from the patient or client. And so we might say, we might vet these resources and then let the patient or client know their options. So I'm going to refer you to a dental office. This dental office is not necessarily gender affirming. They may refer to you by legal name or legal gender marker, and I want you to be aware of that before I refer you. But they're the only dental office in our current local small rural community. So these are ways that we can again provide autonomy to the patient or client in making an informed decision, but also set folks up to understand and prepare themselves ahead of time that there might be additional roadblocks or barriers that they experience, or that there might be additional misnaming or misgendering or not knowing how to serve trans people that occurs in this environment. So we don't want to withhold resources because they are not gender affirming, but we do want to make sure that we are providing folks the opportunity to make an informed decision around getting their health needs met. Also, if we're having to do things like lab work or send like a paper referral, depending on how that prints out of our system, it might include legal gender marker and legal name. And so if we know that that is going to be present, we can also inform the patient or client as to that they're going to receive paperwork with their legal name and legal gender marker on them, and that that is part of the system and also connects back to insurance or whatever the rationale or reasoning is for that. So when folks have information and understand the context and the why, they're able to make more informed decisions for themselves. And then the final piece is follow up. So follow-up can look like a couple of things. Were we helping folks to get their next appointment scheduled? Were we working with registration to make sure that that they're being able to schedule under their current name and their pronouns? Do we connect that to their legal name and their legal gender marker, but we make it clear that pronoun what their pronouns are so that when they follow up, we're referring to folks by the pronouns that they go by? These are all ways that we can prepare to be more gender affirming in our follow-ups. And then also checking in with our trans and non-binary patients or clients and asking them how their experience was at the referral. What was their experience at the lab? Did they have any challenges getting their blood work drawn? Was there any uncomfortable or um, transphobic experiences that they had? This can all prepare us as clinicians, as public health providers, in making sure that we are creating services and bringing getting feedback from our community as to how these services are impacting them. And I see, Shakina, you added here, depending on the specialist or comfortability of the service user, a peer ambassador or specialist could attend the appointment together. Absolutely. And this sometimes can happen for us if we sometimes we have friends who may come with us and join us for an appointment. I know that when I have gone, not just for gender affirming care, not just for trans and non-binary people, but when I've gone with a friend or a family member and introduced myself as a patient advocate, that suddenly everybody buttons up, and the services that we receive are much more clear and concise. But the reality is that sometimes we're getting news, we're getting information in a medical setting that can be intense for us. So, how can we have someone present or collect like record information so that we can refer to it later and better understand it and start to integrate what we are learning as well. So even if you don't have an ambassador or a specialist present, we can also ask things like, can I record the session so I can make sure that I understand the instructions? I want to make sure that I get notes, or I'm going to write down notes, so we need to go slow. We can ask for these accommodations because they are appropriate accommodations. And I've heard providers sometimes get nervous about recording because of fear of HIPAA violations. But if I am the patient and I'm recording for me to use this information, then it is appropriate. It's not a HIPAA violation. So I think that these are important things for us to figure out, like what our rights are as a patient as well. For the last few minutes, I want to circle back to the master status thinking, which Shakina, you had brought up before. Thank you so much for sharing that. The so the master status thinking is, like I said before, when we reduce someone down to one aspect of their identity, or yeah, really one aspect of their identity, and then we hyper focus on that piece. So it might be someone coming in who's trans or non-binary and is um, experiencing symptoms, cardiovascular symptoms, or upper respiratory issues, and the focus from the provider is just on their transness, is just on the fact that they're taking hormone replacement therapy, etc. And so other health needs might be overlooked, or health needs might be believed to um, not be because of that. Uh, uh, the symptoms might not be recognizable as what they actually are, and we might just assume that the symptoms are because of trans identity or something having to do with hormone replacement therapy or gender affirming surgeries. And so it's important that when we're serving trans and non-binary people, that we are not just using the fact that someone is on hormone replacement therapy as a rationale for all symptoms that someone might be experiencing, and that we are not only focusing on a person's transness, and our own curiosity around a person's transness, to avoid doing the kinds of assessments that we would do with patients who are cisgender. So what I mean by that is, we don't want to just focus on a person being trans or non-binary, who's coming in for example, an upper respiratory infection, or because they're having trouble breathing, and only talk about the gender affirming surgeries that they've had or their sexual health needs, because that's not what the person is coming in for. So we step away from that when we start looking at the individual holistically, and providing gender affirming spaces is a way for us to provide a holistic environment for folks to then build that rapport and that trust with us, and start to share what their health needs are and their health goals. So I hope that this has been a helpful conversation today. I'm really grateful. Thank you so much, Shakina, for being here. Thank you so much for folks who are checking this out on the replay. I'm really grateful to be able to continue to have these conversations as part of Ask Miss Jai Live. Again, if you are catching this live, please put a hashtag live in the chat. Let me know what parts of this conversation you found most interesting, or other ideas that you have. If you're catching this on the replay, go ahead and put a hashtag replay and let me know. I would love to hear how your clinic, or if you're in a CBO setting, or if you're in an educational setting, or if you're doing any sort of health service, what are some ways that you are actively trying to be more gender affirming in the service that you're providing? I'd love to hear some responses in the chat, in the comments below. Again, my name is Miss Jai. I use she, her, and he, him pronouns. I am the host of Ask Miss Jai Live, and we are here every Sunday at 5 p.m. Arizona time. I'm really excited. We are just a few episodes away from wrapping up season 3, which is super exciting. So please subscribe. If you enjoy this content, if you enjoy what I'm sharing with you, please subscribe to my YouTube channel. At Ask Miss Jai. And if you enjoyed today's conversation, please share it with other providers in your network. Please go back and take a look at some of the other videos that we've recorded, and some of the other information that I've shared, and share those with your providers as well. Because I think the more that we can share out this information and start these conversations, the more we will demystify serving trans and non binary people. So until next week, thank you so much for joining today. I hope that you have a wonderful day. And as always, thank you for investing in the health and well being of trans and non binary people. Stay safe.